Now, if you're over the age of 50, it is time for you to get a colonoscopy. I know you guys don't want to hear that. If you have any potential risk of colon cancer, which is a serious cancer, one of the ways we're going to start looking for this early on in your life is at age 50, what is recommended is called a colonoscopy. So a colonoscopy is basically when you take a scope and they go in through your rectum and they're looking inside of your colon for any kind of abnormalities. When they're looking at your colon for any kind of abnormalities, they're looking for polyps, looking for any kind of growth that you have in there. And they might even do biopsies whenever they're in there. They go in there, take samples of your tissue, take it out and test it. Now, if you have a family history of cancer, especially if you're a man, and especially if you have a family history of colon cancer, you should be doing this sooner than later. We'll send patients in as early as 40. Sometimes we'll send them in at 45. And definitely 50 is the recommendation. So colon cancer screening is super important. Remember guys, like with all cancers, the sooner you discover it, the better. Now, what if you don't want to go in and do the colonoscopy because you're scared? Looks like all of our guys are. They're terrified of this. 1, it's not that bad. 2, they're gonna take good care of you. 3, you're gonna be knocked out most of the time if you request that. Now, if you still don't want to do that, you have to understand the gold standard for screening for colon cancer is the colonoscopy. The gold standard means pretty much that's the general consensus among the medical community that this is the way to do it. Now, there's other tests that are available, but they're not the gold standard, just so you know. There's actually stool tests that you can do, right? There's stool tests that if you want us to do that, we can ship it to you directly from these testing companies. One's called Cologuard. So basically, this kit's going to show up to your house. You're going to put your stool sample inside the little sample box, ship it back, and they're going to check your stool, screening for these things. This way, you do not have to do a colonoscopy. Not that that's recommended, but just want to let you know that's an option. So another thing you can do is a CT. So they actually have a test here that we can write up for you here at the practice, which is really pretty cool. And it's called a virtual colonoscopy. So with a virtual colonoscopy, they're not actually going up there with a camera, but they're doing a CT of your colon. So whenever they do this virtual colonoscopy, super easy to order. 1, we have really good pricing on this for you guys. Really, really good pricing. So if you're a patient at the Phoenix Men's Health Center, we have special pricing for you guys to get this done. So if you are terrified of doing a colonoscopy, you don't want to send your stool in a little box, there's another option. It's called a virtual colonoscopy. Again, it's not a gold standard, but it's an option for you. So just remember guys, there's options. There's always options. Don't be scared about what your buddies tell you on the golf course while they're out there with their horror stories about their colonoscopy. You got to get it done. The sooner you screen for cancer, the better. And colon cancer being as serious as it is and relatively easy to diagnose with some simple testing, it's definitely worth it. All right. If you guys are over 50, if you're a patient of ours or you're a patient somewhere else, you need to ask your doctor about what you need to do to start screening for colon cancer. The earlier, the better.